This segment is sponsored by the Richmond Smile Center.
According to the World Health Organization, nearly 18% of women and 7% of men in this country suffer from migraines, and chronic migraine costs exceed $4,000 for sufferers on average each year. How can looking inside your mouth make a difference? Dr. Charles Martin with the Richmond Smile Center joins us to answer that question. This is pretty progressive, Dr. Martin.
Yes, it is.
This is pretty progressive.
It is.
Good to have you with us this morning.
Thank you.
Very excited to learn about this because migraines are not something that people can fool around with.
No, it's very pervasive and persuasive, too, for that matter, a person who doesn't want to have that as an issue.
Yeah.
And what's interesting is the high numbers of the population that have this, ranging from mild to severe. But about 15% of the population, even as much as 20 in some people think, have this issue in a significant way.
Okay.
And with loss of days of work, change of social life, lots of things. Lots of people have migraines who have been through the if you will, the medical gamut. They've been checked by the ENT, maybe the OBGYN. They've had an optometric examination. They've been to a neurologist, and they haven't gotten a solution. So often the people we see are those who've been through that, who want some help. And it's that reason that we're here talking about it.
Yeah, those people have clearly also tried spending the 2 days in a dark room just hoping this goes away, but there's a potential solution here.
That's absolutely correct.
Now, how does it work?
Yeah, that's a good question. First of all, it's important to understand that the dental nerves, the nerves are in the face, all meet up in a special place at the base of the brain, in the back of the neck, called a ganglion or nucleus. This trigeminal nerve, the dental nerve, has been shown to be the source that causes the substances to be secreted that cause the vasodilation of the cranial vessels that cause the pain.
This seems pretty progressive to make that connection, right?
Yeah, this is based on science.
Okay.
And so we know that this trigeminal ganglion, this place, this nucleus back at the back of the head, is the place from which all headache pain comes from. So, if that's true, is it possible that the function of the teeth, the joints, and the neck are connected? Absolutely they are. And so now we're able to look at things from the standpoint of dental forces. The miracle, if you will, is that the effectiveness of this, ranging from complete elimination to vast improvement, is about 95%.
Which is darn close to being,
yeah, it's not.
Very close.
Don't even use that word. It's not that, but it does make a striking difference for so many people.
Now, when folks come in to see you, you look inside and are doing a scan. We have some images of this that we can show. Talk us through what we would be seeing. Of course, you've talked about this part of the brain and the head and where that ganglion bit of nerves is all coming together. But next, we have this image that really shows a scan. Talk us through this.
Yeah, this is a computerized way of looking at how teeth come together. And imbalances of dental forces cause changes in muscles and changes in nerves, which go into that ganglion and can help stimulate headaches and lead to migraines. Is it a direct connection? Not direct, but the indirect connection is so significant that many times treating patients who have dental force related issues, and about 80% of people do that have these headaches, then we're able to effect some very significant improvement for people. And what's interesting as I talk to my patients as we're going through these steps of treatment is they smile at me a whole lot more. Their lives change. Even from the very first treatment, they're starting to get significant improvement. And so this isn't just a subjective measure. We're doing objective measures. So we know that when a patient is improving these forces, and we're also evaluating the neck. And I think we have a graphic of that too.
We do, yes. We'll take a look at that as well. We have a picture here of range of motion.
Right. So we know that folks who have a restrictive range of motion in their neck are more likely to have issues. So we're objectively able to measure improvement as a result of therapy. Now, one thing we haven't talked about, what brings all this on? And it's major trauma, common in a car accident, and one only has to be going 8 miles an hour to have enough injury.
Which is not, you almost can run that fast if you're really eating your Wheaties, right? I mean, so it's not.
Yes, that's exactly right.
Yeah.
And you know, when you talk to people, how many people have been in a car accident? It seems like most. Secondly, it's more women than men. Although men do have the problem, it's more women than men because physiologically and physically, the trauma affects them more than it does men.
Well, it looks profound, and it's really profound to learn that there is hope.
Absolutely.
That makes a big difference.
It's more than hope.
A strong connection to feeling a lot better.
Thank
you, Dr. Martin.
Thank you.
You can connect with Dr. Charles Martin and the Richmond Smile Center. Visit 11201 Huguenot Road in Richmond or call 417-7203 and visit online to learn all about the ways Richmond Smile Center has been creating beautiful, healthy smiles for over 30 years. Right now, we're going to send it over your way.